Well, employer-sponsored healthcare premiums are expected to see a huge jump. As much as 10% or more is going to be your cost added to next year. It's just the latest ballooning cost expected to be passed down. About half of us, 50% or more, get our coverage through work. And it seemingly is going to cost us a lot more unless there's a workaround for it. If there is, this guy knows the answer. His name's Paul Seegert. He's with PCS Healthcare Advisors. They contract with and consult businesses about reducing their healthcare footprint and cost and the like. And Paul, good morning. How's things?
They're great. They're great. Not if you're looking at how much more you're going to pay for health care, but
right. Well, I guess the good news is here before the August recess hits in Congress that the Democrats, and one of their top priorities of many, is to pass a filibuster-proof bill that includes policies to lower prescription drug costs and an extension under the Affordable Care Act and all that to possibly stop insurance premiums this fall. So we'll have to borrow more money to keep more of our money in our pockets, if that makes sense. At least that's the plan anyway. Even if this gets through, what is the likelihood that's going to reduce cost?
Well, it won't reduce cost for the 50% of Americans who get their coverage at work. What they're going to do with that legislation, or what they're attempting to do, is extend some of the subsidies that were put in as part of COVID relief, where we basically funded more of the premium for Americans if they went to the exchange. And that was set to sunset at the end of this year. So they're talking about pushing that out for another 2 years. And that actually pulled some people from other sources of coverage. I mean, it created what we call in our business moral hazard, where you kind of encourage people to do something that's in their best interest, but maybe isn't in everyone's best interest.
Right.
You could have a 60-year-old couple making north of $200,000 a year today getting a subsidy if they go to the exchange because of that COVID rescue, those rescue dollars. And it's probably a reasonable question to ask, is that how we want to spend our money?
Right.
But, and then if you look at what's happening with employer plans as we're heading into renewal, they might be able to insulate the 10% increase that's coming for the ACA individual plans, those marketplace plans, for those that are in that, by, like you said, borrowing money and covering some of the premium. The cost will actually go up.
Of course.
But you might be insulated as an individual. If you're getting it at work, however, we're staring one of the biggest renewal seasons in the face, I think, in terms of increases. It's averaged 6% for many years, what the increase is, which is always kind of historically about doubled inflation.
Right.
So it's no surprise that it would be bigger this year than 6. 10, 12, we're seeing in some markets. Rules are different in different markets in terms of how early they have to tell you what your increases look like. Some markets, they're already having to tell you what your increases look like for this next coming cycle, and they're coming out at 12 points.
Yeah, so 10 or better in most cases, which is a pretty substantial hike. And this has a lot to do with, obviously inflation is a factor here too, but it's like anything, right? College loans, if you subsidize it and throw more money at it, the price is just artificially going to increase in the back end. And, if you get a subsidy, you're fine, but who doesn't get the subsidy, I guess would be the question here. And therefore, that's the group that gets squeezed, which would be whom?
That's exactly right. And that's everyone that's the 50% of Americans who get their coverage at work. They're the ones that are going to get squeezed, and the employers are going to get squeezed. And this, to me, is one of the most important conversations to have around how we pay for health care, that we don't have enough. And really, we have it on your show. I don't know where else it's being had, that, frankly. And that is the fact that our whole payment model, our whole system, is based on these employer plans footing the bill or subsidizing other plans. Yeah, Congress may pass some legislation that subsidizes these exchange plans. Sure. But when you look at how hospitals conduct business, as an example, they don't even expect to make money on Medicaid or Medicare transactions. Oftentimes they lose money on those transactions. And then they turn around and look at these employer plans, and they have to charge them wildly more, 3.5 to 12 times for the same transaction, what they charge one of these Medicaid, Medicare plans. So you have an inequitable system where we're asking employers to also subsidize the government payer. And that's where, when people talk to me about how we're going to save this, we're going to fix this problem with single-payer health care or Medicare for all, not at the same quality.
No.
If they need 140% of what they get from that Medicaid or Medicare transaction to make money, then you would have to, what are you going to do? You can't.
Right. So what you're saying, Paul Seegert, is if you're the 50% of Americans who get employer-sponsored health care, you're a sucker almost.
Yeah.
Is that true?
I mean, you are, and the employers are in a tough spot. This is the reason why pay increases have payroll deductions for healthcare premiums have outpaced payroll increases. Pay increases. Mm-hmm. So as employers, we've been working to make less because we're paying more for health care, and that doesn't account for the fact that the employers are still picking up the majority of the bill, and what they're shouldering is going up. And so then inevitably it causes other problems. We have to water down the coverage because neither the employer nor the employee can go to work, mm-hmm. 4 days a week just to pay for health care. So then you have these plan designs that create more problems in the system. You want to talk about medical debt? Most of the medical debt that's held in this country is held by insured people, and 58% of third-party debt in collections is medical bills. And so what are we doing to solve that? Oh, we're just changing the way it's going to show up in your credit report. We're not actually addressing the real problem, which is overpriced, all the waste in the system and stuff.
Yeah.
So it's crazy.
It really is. It's something else. And Paul Seegert of PCL's Healthcare Advisors and talking about the great sticker shock of employer-sponsored healthcare premiums this fall, when typically you have your review meetings or the big meeting or the Zoom meeting regarding benefits and, signing up for that enrollment period. And even if you just continue what you had, you're going to be shocked to learn it's going to cost you in the upwards of 10% or more this year. Some maybe a little bit lower, but in a lot of cases even around 12%, which is a hell of a lot of money. And it has to do with subsidy and a bunch of other factors as well. Did you just outline the case there saying, hey, if we just got rid of employer-sponsored insurance and had single payer, is that going to, the buck has to stop somewhere? And I guess our taxes would have to pay for that. But is ultimately that where we're headed in the sense, and that is squeezing people who work out and going, why am I paying for employer-sponsored benefits when I could get the ACA cover, the Obamacare stuff, and it's going to cost me less? Is that kind of what they're trying to do here, and will it work?
I think you make a very good point there. You've already, that moral hazard I was talking about earlier, we already had created what was a temporary draw off of work plans, employer-sponsored plans. When you have a 60-year-old couple making a couple $100,000 a year that can get subsidy, it makes sense at their level to look at that and do some cost-benefit analysis and say, okay, I'm getting some of my premiums paid for by my employer on my employer plan, or I go over here. Well, maybe it makes sense to go over here. And then you have employers that are small enough where maybe they don't have penalties related to Affordable Care Act stuff. So, there's no penalty for them to say, go to the exchange, get it there. Mm-hmm. So we are creating a draw off of employer plans, which is going to really just worsen the problem because we're going to have less people in that system. We've got almost 50% now in the employer model that's funding the profits for the whole industry, really. And then we squeeze that number down. Sure. If that drops to 40, that 40%, they're going to get hammered even harder. And at some point you're looking, and then Paul, at some point you're looking at it. If you're an employer, you're looking at, wait a minute, it's cost. I'm getting less coverage or the same coverage for a lot more money than if I would just go with the government plan. And so it'll completely unravel the healthcare system as we know it. But long term, is that a good thing or a bad thing? Well, I believe it'll be a bad thing because the only players in the system who are responsible enough to and have a real need to fix this are employers. They can't just print more money or borrow more money to pay for something that's unreasonably priced. So the solution, in my opinion, to our whole healthcare problem is well-run employer plans. And the top quartile performing employer plans run at a significant discount to the rest of the market because they have figured out the fact that they can get a consultant and they can tear apart what's going on inside their health plan and eliminate the waste, just like they do in all the other cost drivers in their business. And if you're is the government going to do that for the plans they're paying for? No, they're going to solve the problem by subsidizing more. Right. We spend a ridiculous amount of money. It's north of $20,000 per person we put on a government-provided plan and what we're paying. And that's very inefficient. It's way higher than it should be for a coverage that's considered kind of second class in a sense. A lot of providers don't want to take that plan for that coverage, and we're paying more for it. So that's a very inefficient way to go if all we're going to do is borrow for something and let the industry just keep piling on.
Right. Because you're borrowing money with interest, and it just increases the deficit, which adds more to the problem, and it creates more of the same.
Hey, if they said, Paul, you can buy a car, any car you want, the government's going to pay for half of it. Hey, my budget just got a lot bigger.
Right.
You know,
Absolutely.
And that's basically what we're doing with healthcare if we keep trending this direction.
And you're creating demand, which is going to cause the dealer to raise the car of that price, regardless of whether or not that's the value, because that's what the money does. Again, back to the college model. What did we do when we subsidized college? And it's unaffordable, so we're going to give you more subsidy. Well, then colleges just increase the cost because now everyone feels qualified to do it, rather than just saying, "Hey, listen."
For-profit colleges are really, in the loan business, all kinds of stuff that happens.
Yeah, right. Well, bring your dog to the vet, right? I mean, typically you go and something like that, or a procedure that's not covered by insurance. LASIK could be a great example of that, where the cost of LASIK when it was first developed 20 years ago was substantial, and now it's like, what, $70 an eye or something? It's because people are paying that out of pocket.
Exactly. So is there a solution to healthcare? Yeah, it's called free market forces. We don't have that in the normal delivery model that we all see today. We think we do. We're America. This is capitalism.
Yep.
No, not really. If you don't have transparency, when you find out that 0.5% of hospitals in the 3 largest hospital chains are actually in compliance with the transparency rule, that tells you they don't want to comply. It's not that they don't have the resources. They're not eager to broadcast to the world that they have more than 150 prices for every procedure. They're not eager to broadcast to the world that they're losing money on these payers over here and piling on these payers over there. Same thing with drugs. We're paying 10x what our peer countries pay for the same drugs out of the same factories. They're not eager to expose where all that waste exists and give that up. But employers, the best run employer plans are cleaning that up.
Well, look at it this way.
They're not taking it anymore. They're at a breaking point.
Right. Republican lawmakers love it because they're getting money from those middlemen and everyone else. Democrats love it because they go, well, we'll get more subsidy and we'll reduce it for people who are in our wheelhouse. And that's why there's no movement to try and fix the system as it is. I mean, it sounds good to talk about single payer and Obamacare, but they don't want, neither side wants it fixed because it'd be rather simple, as I've talked about many times with you, and that is simply you pass a law that says your employer can no longer manage or handle your personal health care. You have to buy it on the free market like anything else, and all of a sudden it collapses. But again, they lose power. They lose money. They lose PAC money. They lose all that stuff because they're not the ones controlling it anymore. If we give the freedom back to the people to decide where they spend their money, the problem resolves itself. Even for people at the lower end who are indigent and sick and chronic, you'd still save enough money in the system to take care of those people fully and still give everybody a break.
We're paying $2 when we should be paying $1. I mean, that's a really high-level analysis by Paul Seegert, but it's a fact. I mean, you can see it. I can see it.
You can see why you're a partner.
Well, we cut them in class. We cut them in half, the cost in half. And the thing is, what you just said is the solution. All we need to do is give consumers good information to consume, because even lower-income Americans, hey, if you give them the right information, they'll make good consumption decisions. If there's anything we're good at in America, it's consuming. But when you think about healthcare, it's the one thing you go and purchase, and you purchase a large ticket item without any knowledge of what it's going to cost until after. You ask the provider, what's that going to cost? They look at you like you're asking a crazy question or something.
How many restaurants you go to, Paul, where they're like, well, we don't know what this dinner's going to cost. We'll just give you the bill when you're done. Right?
I just had a hernia repair surgery 6 weeks ago, and I'm a nerd. This is what I do. My hernia repair ended up costing all in for a surgery center, anesthesiologist, 2 or 3 of them came and did something to me, a surgeon, blood work prior, visit to get it diagnosed, visit to make sure it all worked out okay, under $5,000. But I presented as a cash payer.
There you go.
And I asked what things were going to cost, and I consumed like I would other things.
You locked them in, right? But you have time to do this, and it's your job. I mean, the average person like me, I don't even know where to start.
Fair. Yeah, it's not fair. But if we could give Americans easy access to information, and best employer plans are doing this.
Yeah.
The best employer plans, they actually are giving them more than just in and out of network. Here's what my copay and deductible are. They're giving them in and out of network, but they're also saying, here's if you choose this low-cost, high-quality provider, we will waive your deductible. Hey, that'll create some incentive.
Yeah.
Americans are tired of spending all their pay increases on being functionally uninsured.
Well, it's gonna be worse here between inflation and a looming recession here. We also have the news that Paul Seegert presented from PCS Healthcare Advisors. Expect around a 10%, some less, but many more than 10% increase in healthcare premiums this coming year as we go into benefits season and open enrollment and all that's right around the corner here. So be prepared. Paul Seegert, PCS Healthcare Advisors. Thanks again, Paul.